one of the topics or questions that parents and families often bring up regarding children who have ADHD and are receiving stimulant medication treatment for ADHD is whether or not drug or treatment holidays are indicated. And what I mean by a drug or treatment holiday is structured time off the medicine. In the past, physicians would recommend taking the weekend off, not taking the medicine, only taking it during the school week, and or taking the summers off during times of theoretically less demand on a child, less structured demand. We don't typically recommend this anymore as a matter of course, because ADHD affects much more than just a child's or a person's academic functioning. It affects their social interrelatedness, their ability to get along with others and have fun, such as in a camp situation with a child. So options include, with children on stimulant medication for ADHD, taking the medication 365 days a year, and as long as symptoms are managed. We will initiate a trial off medication if a child has been symptom-free for a year and hasn't needed to increase dose despite growth and development for a year. So that's one situation where a trial off a medication could safely be accomplished, but it needs to be, again, during a time of low stress and low transition. For the most part, we recommend children stay on their medication unless they're having significant side effects, such as reduction in appetite, difficulty falling asleep, or in some way the stimulant is affecting their physical health. So if a child's having trouble gaining weight and has fallen off their growth curve, yet still requires a stimulant to do well in school, a summer would be a time when we would actually consider a drug holiday, treatment holiday, in an effort to let them catch up. But this is done with very close monitoring and to make sure that they're still able to do well in whatever activities they've got going on for the summer.
If they go on a drug treatment holiday for the summer, what is a good strategy for beginning the reintroduction of medication prior to the beginning of the next school year?
I tend to tell people, well, number one, prior to the next school year, first thing you want to do is a few weeks prior start getting children back on their sleep schedule that they'll need to have, get them back in the structured routine that they're going to need to have once school starts. Especially if a child has difficulty, has ADHD or just has difficulty, sleep is very, very important. And those early morning awakenings for school and the earlier bedtime can really help out getting that started and getting that rocking and rolling prior to the beginning of school. Secondly, you'd want to visit your provider and start working a few weeks at least before school starts to reintroduce the stimulant, because typically we start with a lower dose and work back up to where you were. And, any side effects that were present at the beginning of treatment when you started the medication that may have lessened or disappeared over time are possible experiences the child might have when restarting the medication. So, in order to have them as stable as possible before school starts, you'd want to do that a few weeks prior to give them the best chance at succeeding and having some structure in place before the changes and stress of the new classroom schedule and structure.
Some parents I've spoken with discuss having a child with the hyperactive aspect, ADHD, and then I know of parents who have children that have the ADD where they seem dreamy and disconnected. And with that, do you notice any behavioral differences or any other yet considerations that need to factor into what you just stated?
Attention deficit hyperactivity disorder is currently defined under two major subtypes. Inattentive type, which is the folks that are dreamers and having trouble with focus and paying attention, but not necessarily having outright behavioral problems. The hyperactive subtype are the kids climbing the walls, can't sit still, loud, blurting things out, and tend to actually be diagnosed more easily because they come to the attention of teachers and parents due to the behavioral problems. So it can factor into the decision of what you do with medications over a summer, because if there's not a lot of behavioral troubles, that can make it a little bit easier depending on what the child's doing, what their activities are for the summer, how much demand there is on their ability to be structured, focused, disciplined. So that does weigh into deciding the continuity of treatment. Because if they're going to be getting into behavioral trouble and they're very hyperactive, that would suggest it'd be much better to continue on the medication.
Any other holistic suggestions you might have for children or their parents?
Yes. Summer is a much less structured time, which should be less structured to a certain extent. However, in the population of children that I treat, regardless of diagnosis, whether it be depression and mood disorders or ADHD, trying to maintain a stable sleep schedule and sleep structure and enough sleep is very important. So within reason, whatever families can do to make sure that their children aren't just staying up as late as they want to and sleeping in as late as they want to, will be helpful in the long run. And certainly anything that can be done to maintain structure will aid in that transition back to school later on in the fall. So that's one thing. Number two, children do need some structure to their days. Because there's more free time during the summer, it's important to remember that limits on media consumption still need to be in place. And that is difficult as a parent sometimes. However, it's important to remember to try and be moderate with the amount of screen time that children get, because it does impact their development in ways that we don't even fully understand yet, but it does. And so it's just important to be mindful of that and try to be moderate with their media consumption.